I'm Kimberly Green, and I'd like to let you know why the Green Family Foundation is proudly supporting a new concept in medical education at Florida International University. This program at the Wertheim College of Medicine brings graduate students in the health fields into direct partnership with members of Miami's most underserved communities. Sadly, Dade County, Florida has one of the highest rates of uninsured residents in America.
Data that perhaps you are helping.
While this presents tremendous challenges, it also presents an opportunity to learn, as it is a perfect laboratory for exploring healthcare solutions. From this kind of alliance, we can learn from each other and affect real change, as healthcare is a fundamental human right. Here now are the people and the mission of the Green Family Foundation Neighborhood Help Program.
"43 dreams, 43 young medical students with the dreams of changing the world, the dreams of becoming physicians, the dreams of making the impact that will make a difference."
We went for a real diverse group that came from every different ethnic group, socioeconomic group. So our physicians are 21st century physicians.
When they leave, they will be culturally competent, they'll understand diversity and celebrate it, and understand the complexities of healthcare in the community.
I know that at other medical schools you have the chance to participate with families, and there are probably some great programs out there, but there was nothing as comprehensive as the opportunity to get into the community for 3 years.
We get a hands-on approach from very early on that helps us not only shape the doctors we become, but it also shapes what fields we want to go into.
This is such a unique program that no other medical school in the country has. This is going to change the way medical school is taught in the United States.
The program is, in essence, the largest fundamental change in medical education in this country in 100 years since the Fleckner Report. Because if you think somebody really needs something done, you're going to be assigned households, where you will go in and you'll start taking histories. You're going to identify issues that need to be taken care of with these families, whether they're social issues or medical issues.
We talk about lived experiences and why this program becomes important. It becomes important because you pick up those things that you won't get trained on.
The majority of schools you do maybe 1 or 2 home visits, usually to a geriatric population. In neighborhood help, we're doing something more extensively. We're taking a longitudinal history of all the household members, and we're working with the families on a particular issue that they identify as priority, with the idea of graduating both the students and those families to sustainable change.
The families that you're going to see are largely African American, maybe 1 or 2 Haitians, 1 or 2 Hispanic.
We want to be a partner with the community as long as it takes to really make a difference. Never leave.
Miami is a city of opportunity. Miami is a city of extreme contrast. We have the wealthiest city, Fisher Island, where you can take your car for a boat ride. And then we have the poorest parts of the United States, the city of Miami, Opelika, North Dade areas. But Miami is a city where poverty is sometimes lost because of the palm trees and the pastel colors. Nobody in this house has insurance. So do you really think, A, they're going to go for a regular checkup, or B, if they do, it's going to be some guy that's practicing perhaps without a license, which is not uncommon down here in South Florida either.
The trend is that the poorer you are, the more unhealthy you will be. And the richer you are, the more likely you're going to get health care. No, it's not only because of the amount of money or the resources, it's also the environment around you. The things around you that tell you you cannot succeed, or you shouldn't look for all these things, or you don't deserve these things.
¿Hace cuándo que lo cerraron?
2 años.
So 2 years ago, they closed the plant. 12-year employee, they transfer him from Jersey to Miami, they close the plant, and that's it. No benefits, nothing.
Yeah.
Somewhere along the line, it became socially acceptable to refuse a patient because they had no money. Socially acceptable within my profession, socially acceptable within society.
We have insurance when I work there in the factory. We have a nice insurance.
Yeah, but not now.
But not now.
I would say that human beings adapt to their condition, which in some cases it is a good thing, in some cases it's not. I mean, how could you survive if you were saying, I don't feel fine, I don't feel well, but I can't do anything about it.
She has a prosthesis that's been put in to help her hear. She's deaf in that ear. What happens is when she had insurance, it was fine. Now you can palpate actually the metal screw right outside. You can actually see it. And she has recurrent infections at that site.
What I think that we have here in this community is 60% of the community that feel that they are sick, but many of them feel that the level of illness that they have is not important, that they are fine with it. So they do not transition into appropriate management, and they will have to suffer later the consequences that they do not know that they will be suffering of even dying young from those illnesses that they do not control.
When was the last time you went to a doctor?
I don't go to the doctor that much, only if I'm if I feel sick, but normally.
To be healthy and well, the more educated you are, not just rich, but the more educated you are, the healthier you are. Education and health are linked.
If I were to ask you to look in your refrigerator, would you let me?
Oh, you could, oh, might not.
Open it up, let's see what's in there. Okay, let's go through all the healthy stuff in here.
Okay.
Let's see, wait a second. Could you get a bigger butter?
So if we can really work on the educational attainments in the homes, then you can read those labels and you can make better choices. The data shows that if you're more educated, you make better health choices. You take less risk overall.
Social determinants, the true cause of disease in the United States and in the world, the number one cause of disease in the United States and the world. So if a doctor does not understand the cause of disease, how can you properly treat it? That's number one. Number two, if you don't understand the social determinants and the limitations, how do you take care of somebody that lives in these environments? Can I ask you some medical questions?
Absolutely.
Have you had your colonoscopy?
No.
No?
No, I'll tell you why.
Why?
I'll tell you why. The doctors twice says, I cannot stay 2 days without food because...
Oh, we can do it in half a day.
People like to attribute disease to either genetic factors or personal choice. And really, although those things do play some role, it's the social community factors that play one of the larger roles that hasn't been examined nearly enough.
What we are as physicians is to go back and understand the person that we're treating. That is not just, to me, it's not just a diagnosis, but it's a person who comes from a family, and that family lives within the community and within our society.
She's going to be one of the best doctors you will ever see.
Don't forget me, don't forget me.
I will.
You know, I love these people that like her, that they learn something useful for human beings.
When I was 2 years old, I became Florida's first liver transplant recipient. So I've literally been around medicine or involved in medicine since I can remember. I had a big giant Mickey Mouse doll when I was a little kid, and I remember, Mickey's going to the doctor, as maybe even like 4 years old. I know what it's like to be laying in the bed and relying on other people to save your life, and I really want to pay that forward.
The reason why I decided to go into medicine was my grandmother. She was very sick all the time. Every memory I have about my grandma, she was, somehow sick. So I was very frustrated, is the word. Every time my grandma was sick in a bed and I couldn't do anything.
My pediatrician was African American, and I feel like if I hadn't seen him, I probably wouldn't have even thought I could become a doctor. Other than him, I never even met another black doctor until I really started interviewing at medical schools. Everyone thinks they can become a doctor, but if you don't even see someone that looks like you or comes from the same area as you or the same background, then you may not even think it may be possible, but more like, trying to reach for a star.
You see, my whole family is a family of physicians. I'm number 28 in 3 generations. My dad always made the joke. I give her 2 choices. Either she can be a physician or she can go to medical school. I want to be able to serve people that need to be served. I just want to feel like I'm needed. And if I can just have that kind of feeling and feeling like I'm needed in the community, then that's enough for me.
I really want to help people. And it's true, you can help people in many ways. But I think that medicine, you have the ability to mix the scientific background that you learn and apply it directly to changing people's lives directly in an instant. And not only being able to take care of that person individually, you'll also be able to take care of the family too. Because you're not only treating a patient, that patient is a dad or a brother or a son. That's one of the things that inspired me to say, you know what, I want to take care of somebody, I want to take care of a family, I want to take care of people.
It really comes down to one focused issue. Does every individual, as they sit here today, have access to every service that would improve the quality of their life? And if not, why does that occur?
I hope that these students come out and, you know what, they take the patients that are unfunded, the patients that need care. They just take patients. That's what we hope to see in 10 years. We hope to see the fact that we physicians would have to say, well, we're doing what our oath tells us to do.
10 years from now, I see myself in Miami, working in my practice, probably working for a hospital or a trauma center or something, doing as a surgeon, and then maybe even doing some primary care or going out and into the community. I guess I see myself as like a taller Joe Greer in 10 years, where you can be a specialist and you can still take care of like social determinants of health, and you can balance both, and hopefully that's where I'll be.